We have a lot of disclosure of people telling us how easy it is to get opiates, and it's very poorly monitored.
According to the U.S. Department of Health and Human Services, more than 11 million people in this country have misused prescription opioid drugs. Those drugs include OxyContin, Vicodin, and Percodan, and Percocet, all kinds of things. Also, those numbers continue to grow every day, and Senator Bill Cassidy is trying to lower the number of people who misuse opioids. Senator Cassidy is joining us now, and this is a huge problem. It's become, and I think the CDC is calling it epidemic proportions now.
It is. If you look at the number of people who've died, it's staggering. I was just on the North Shore yesterday. They're doing some very innovative things in St. Tammany, Washington Parish. But there are, St. Tammany, for example, is one of the leaders in per capita deaths in our state related to opioid overdose.
And as a doctor, is it doctors prescribing too much? Is it drug companies pushing them too much, or a combination of both?
Combination of the both, plus illegal. As doctors have become more aware of the issue, prescribing less medicine, there's actually been an influx of illegal drugs coming to take over, if you will. So, and folks transition from the prescribed to the illegal. So it's all of the above issue.
And this is one issue where you do see a lot of bipartisan support.
Absolutely. If someone is dying in your community, it doesn't matter whether she is a Republican or Democrat, or whether I am or someone is a Republican or Democrat. You got to fix it. And the solutions will be those that come from different areas of our society to kind of come down to help that one individual.
And can this be solved by just by bills in Congress?
No, it has to take leadership. So Congress actually has about $500 million that we've appropriated that states have not yet used in order to prevent and to treat and to keep into sobriety those people who have been addicted. So there's a lot of money out there. It takes state and local leadership too.
Now, if we can switch gears, you and Senator John Kennedy both were voted against the omnibus spending bill. You said it was just massively overspending.
Yeah, the $1.3 trillion, spending more than agencies had asked for, more than President Obama had asked for.
No compromise on DACA.
No compromise on DACA. The president actually proposed something. Democrats turned that down. It was done in secrecy without any input, and then we get 24 hours to vote, actually less than 24 hours to vote on it. It is just not something that I thought was good to do.
And the big holdup for Democrats was, of course, funding for the border wall. And now the president also says he wants the military to pay for it now.
Yeah, I'm not sure the feasibility of the military spending paying for it. It still has to be appropriated. You can't just do it. On the other hand, there's other ways to get there. We were talking about opioids. One thing I'm interested in, drug cartels move about $110 billion a year from the United States to Mexico. The federal government only captures about $7 billion of that. If we increase the amount we're getting from the cartels, we make a dent in their ability to move drugs. We also can pay for the wall. It won't be the Mexican government; it'll be the Mexican cartels.
But that would not be a wall preventing that. That would be enforcement and police action.
It would be a combination of all.
Okay.
There are some places where you definitely need a wall, and there's other places where other means of securing the border are better. But all we know is that if you can cut down on illegal drugs coming into our country, if you get them out of these kind of areas that are unpatrolled, get them going through the areas where we actually have customs borders agents kind of screening the product, and that's going to increase your likelihood of seizing illegal drug.
And finally, are Republicans concerned about what seems to be a very chaotic White House right now? There's the Mueller investigation, 3 separate lawsuits by 3 different women against the president. It seems to be an open door of staff members coming and going at the White House. Are you concerned about that?
Well, of course you're concerned, but you take kind of, oh my gosh, isn't the economy doing great? We have record low unemployment among African American and Hispanics. We've got an economy which is growing as it has not grown in the last 10 years. We've got consumer confidence at like record highs. All these very positive indicators. So yes, there is an appearance of chaos in the White House. On the other hand, the economy is doing great, and I think that's what matters most to folks.
Quick, and we got to go, but do you think if there were less chaos, there'd be a better economy even?
No, I think that the economy is the federal government saying, listen, we're not going to raise your taxes, we're going to lower them. We're not going to over-regulate, we're going to make sure it's appropriate. And then private initiative taking over. We're seeing that private initiative taking off.
All right, Senator Cassidy, thanks for coming. We
Thank you,
appreciate that. Dave?